I'm going to call the meeting to the Price County Health and Human Services Board meeting to order, and I am Paula Hodak. I chair this committee. And if Meredith, if you would please take the roll.
Thank you. Joe Baratka. Here. Paula Hodak.
Here.
Robert Kopish. Here. Patricia Stephen.
Here.
Dennis Wortko is excused. Nicole Kolwicki is also excused. Sally Hummel. And Gerald Swenson. Thank you.
Okay, thank you all for being here today on this nice rainy day. Wow. Like some thunder boomers last night. All right, so let's get going here. We'll have public comment. Do we have any public comment at this time? Anything online? Star six. If you have anything online, I don't see anything.
Or if you're on a device, unmute.
That's true. That's a new one to add, yes. All right, seeing and hearing none, let's move on. Any communications from the board? Yes, Mr. Kopish.
Yeah, just one thing. When we were dealing with the gravel pit at zoning, there was an issue with an asphalt plant. And I had asked Tiffany if she would look into if there's anything that she could get from a public health standpoint that would have a bearing on an asphalt plant going in that location. And subsequently, they withdrew their application, but it's going to come back. So I just want to ask that if you are able to come up with anything that would be pertinent to what we're doing here, I would appreciate getting that information. So just probably a year from now, we'll be dealing with it again. Okay, thank you.
Okay, so for those out there, Tiffany Polachek said she would work on that. So we'll stay ahead of that if we can. Thank you, Mr. Kopish. Anything else from the board? No communications? All right, hearing and seeing none, we'll pass that on over. The vouchers started over here. Did they go through yet? No?
Yes, sorry.
Okay.
I was reading.
Oh, yeah. And, excuse me, Chris Ann, you're coming up. I'm assuming you have some questions to answer. Ah, there we go. Mr. Kopish, we're all looking at you. Okay. You're all okay too, Patty? Nobody else? No questions for Chris Ann? Wow. They're great. Good. Well, thank you so much. All right. Motion to approve by Mr. Kopish. Second by Ms. Stephen. Any discussion on that? Seeing and hearing none, all those in favor? Those opposed? Okay, motion carried. That was easy. Committee appointments. You want to speak to that?
One thing, Paula, also minutes. Was one more minutes.
I skip those minutes all the time. I don't know why I do. All right, the minutes. What's your pleasure with the minutes, board?
Motion to approve.
Mr. Baratka, a motion to approve the minutes. Mr. Swenson seconds. Any discussion on the minutes other than to get my brain in the game there for that? Hearing and seeing none. All those in favor? Those opposed? Okay, the minutes have passed. Thank you, guys. All right, now committee appointments.
I had contacted a nurse, and so right now she said she would get back to me. I've contacted a few, and I know a couple that I had contacted got back to me and said that they're just on so many committees that they're just not able to add another committee. So I'm waiting for another one that I've put out there. So hopefully by this end of this week we'll know. Otherwise, I'll
They
continue
have
to
to
look.
be active or can they be retired?
I think they can be retired as well. I
Okay.
think I have to look. I have that at back in my office. But
Okay, I'll assume yes unless you let me know different.
okay.
Okay, thank
Okay.
you.
All right.
I don't. Yeah. No.
Yeah,
Yeah, I believe it's just they had to have had it at one point.
Yeah.
because of the knowledge. They have that knowledge then. On to the next one. Subcommittee appointments. Let's see, we had Robin Nielsen's seat is open. I haven't heard anything yet at this time. Still
Yes.
looking.
Yes, I have heard that Beverly Hakenen from Brantwood
Oh,
just recently. So
nice.
Yeah.
Okay. So she's put in her paperwork for that, or?
yes, and I did speak with her on the phone. So
Okay.
yes.
So she's going to be a yes, you're saying, for sure. Nice. That doesn't happen very often, everybody. All right, we'll make sure that gets on there and maybe she can come to the next meeting to be introduced. All right, opioid, let me see, I have mine here, hold on. So just an update to everyone on the opioid committee. We have met twice and we are meeting again this afternoon or at noon. And thank you all for being able to adjust your time from 9 o'clock to 9:45. It just was a long stretch between that meeting and then the noon meeting for some of us that don't live in town. So I appreciate that we could do that and give you guys a little time to have your meeting too then. So that works well. So our opioid committee meeting was, the last one was June 10th, and I'll kind of get you up to snuff on this one. So what we're doing here is we have brought in different areas within the county, our medical centers, our law enforcement, school districts, and talking about the impact of communities and areas of work. And so we've had representatives from each of those areas coming in to talk about what they have seen and what their research shows has been going on in the county. Unfortunately, we haven't been able to get everybody here yet. So today's meeting, we still have 4, I believe, who are still reporting to us. I think someone will be online. Someone will be, has sent us an email. So it's really hard because we're asking people who are working to come in and do this. And sometimes, it's busy where they are too. So for them to give up time to come to a meeting, fortunately, they can come online. So we have found that, and then Nick has also shared possible projects for spending the funding listed by board members from the previous meeting. We have had the 2 meetings of the 5 that are allotted in this ad hoc committee. And the goal of these meetings is to share additional thoughts or specific items for which the opioid funds could be utilized. The committee packet defines the accepted categories. So we have something to go by. It's a standard. It's good that we have that because, you have people, you'll see on our minutes that we had Mr. Robert Knack from his House of Hope come in with a request for some funding. And so, but now that you'll see on the agenda that they are back on the agenda this time. Mark Diston is part of that, and he was not available at that time, and he wanted a few minutes to speak as well. So he will be given 10 minutes, and then if there's a few questions from the committee, then we can carry that through. Let's see. So we've had, so we're still missing Aspirus and Marshfield Medical Center. They're supposed to be coming in to tell us what their thoughts are. We're missing 2 of the school districts, Park Falls and Prentice, with no report. Potential use of funding, looking at the guidelines, and that's going to be the trickier part. There's only so much amount of money that we can spend. And so now we have to really find out and it has to have something dealing with opioid. It's not something that just, we had this in our county. It has to have some relationship to the opioid use of that. So, and some planting is not allowed with this funding. You can use it toward grants or with matching grants. We'll be working on these a little bit more in the next couple of meetings. So we're narrowing down the list and identifying what will be the largest impact to benefit the community. I guess that's right now where we are. Is there anything you guys could add to that, Nick?
Yeah, just so with the process, so we have 5 total available meetings. We're meeting for the 3rd time today. Today's goal is to, everybody's kind of identified in their areas where they're seeing issues or where there could be some spending that might fall within. So today we're going to say, here's the program that they may want to request, here's a budget for it, and then here's what area it falls under. So section B7 or whatever it might be. We have $250,123 as of today that has come in through the opioid funding. We're going to get about 15 to 20,000 for the next couple of years. Once this big chunk's gone, it's not like we get 200,000 a year. Some of the requests are going to be really difficult to fall in. So we've been working on, in the jail, there's a scanner, a body scanner, to make sure that we're preventing drugs from getting into the jail or contraband. And it's really difficult to fit that into this, but we also can see why it would help. We're going to avoid opioids in the jail, which could be a problem. But then there's a lot of things that we're discussing on programs. So once this group has kind of narrowed down how to allocate that funding, doesn't mean it has to be spent immediately. So for example, we've talked a couple times about some programming where we would assist families that have someone that has opioid issues, that right now it's very difficult because we don't have treatment facilities locally or readily available. And it's really expensive to get to these treatments or staying at these treatment areas, whether it's a hotel or whether it's just transportation. So we could make a fund that the department or the unit would manage to say, hey, this family gets a scholarship or a grant to be able to be at the facility or near the facility to get through the programming. But we could set aside, say, $20,000 for that, and that might last 3 years. It doesn't have to be like automatically you spend it by the end of the year. It could be a long-term process. Some supplies to help with the testing and making sure people are staying off the opioids. But that once this group has narrowed down, has a suggestion of a budget and the programs, then it would have to come to the Health and Human Services Board to get its stamp to go to the full board to say, this is how we want to allocate that funding. So there's a lot of steps, but the reason you have that subcommittee is then you can bring together those who are dealing with or working with the citizens that would have the opioid issues or would be educating individuals on preventative opioid use. So there's multiple steps here that we still got to go through. You as a group here will get a review. A lot of the requests, I mean, we could ask some of those people to come in and discuss them when it gets to this level, if need be. But a lot of our staff is part of this group too, so they can help guide this group on understanding if there's program questions.
Any questions? Mr. Kopish?
I'm sure there are people that have problems that don't know what to do as far as getting over whatever their problem is or addiction. And there may be a hesitancy to come forward. Is there something that can be done to kind of make it easier for them to contact or be able to talk to somebody and use the money for that kind of a program? Or I know we got programs, but
Right.
I'm thinking of somebody specifically that I know that's having some issues. I'm just asking a question.
Sure.
I'll just throw it out there. I don't know if there's an ready answer, but we got the money to spend and we should be trying to help people get over their issues. Okay.
Yeah, and that's why we're working, like, say,
Yeah.
with the medical facilities. There's also, you can use this money for training for individuals to identify it. So, for example, if one of the medical facilities said, hey, we'd like to send our staff to a specific training to better identify or to counsel to get to those type of programs, we could do that. I mean, I don't know if there's hotlines we could subscribe to or advertise. We could do billboards, advertisement to say, hey, there's a 1-800 hotline to talk to somebody. We don't have enough to like maintain a staff member or expand to like that type of thing. But if it's just getting the word out of programming, that might be something we can discuss today at noon.
Okay, thank you. One other thing, you've got a Nutrition Advisory Council meeting today? Or not? What do you have
No.
at noon?
That's towards
Oh,
the end
that's
of
the
the month.
opioid.
The opioid.
Opioid.
Okay,
yes.
all right, forget it.
Okay. Any other questions? I mean, that's a valid question, Mr. Kopish, and so that's kind of where we are. We're all kind of like, we don't want to say because we're not real sure. We're going by the guidelines, but you know, it was brought up last meeting when somebody wanted a salary to hire somebody. Well, I don't think that's what we're looking at is.
Problem with like that, it's not sustainable,
Mhm.
in the budget we have. So if you start spending $60,000-$80,000 on somebody, it's 2 years and you're done, but you're also not doing anything else.
And maybe connecting with the behavioral health unit, connecting and seeing what programming they could assist with or help other people with, and we'll be utilizing some of that.
Yeah, and I know we
funding for-
talked a lot about the schools and getting programming in the schools where whether it's an assembly type thing and just educating students on what it is, who to access or who to talk to, but we probably could do more marketing. I know we do programming. That's a lot of the education side of like the coalition and health department. So maybe we expand that in some ways.
So your question won't go unnoticed. I mean, we need to make sure that we kind of keep that in the back of our minds when we're going through the list of things that are coming through for us. So thank you for that. All right. So we'll go to a public health unit. We have Tiffany Polachek and Jojo Baratka. You're going to come on up and present to us on the Substance Use and Mental Health Coalition Annual Report.
All right, good morning.
Good morning.
So all of you should have a 2025 annual report in front of you. So for the coalition, I am one of the co-chairs for this, and I had put together what our coalition was able to achieve throughout 2025. So if you kind of look down to like the community connections, we really try to strive to be very engaged within our community, making sure that they know what the coalition is, who they can come to if they have any type of questions relating to either substance use or mental health. And then throughout the events this year, we definitely saw, especially with the Sport and Home show this year, since we went last year, people definitely know who we are. And when they were walking through the door, that was their first question, was asking, where is the Substance Use and Mental Health Coalition? So that just goes to show what we did within 2025, going to all those events. It really made an impact on the community, and knowing that there is additional support if they want to kind of go a different route than going to a Health and Human Service, if they just want like a resource guide, so to speak. So in the community connections, you can see that we went to the Senior Living Expo. One of the big highlights too within public health as well, there was a partnership to do a Price County Youth Olympics event. So that was held in October. And we were able to get 50 youth involved. And then also that was a good gateway to get different resources for, and then families, guardians, anyone like that would get additional resources. We had a medical facility. We had both of our coalitions tabling that, Head Start. So really a good encompassing of what Price County can offer, and then also specifically for the substance use and mental health as well. Throughout our events, we did a lot of harm reduction. So looking at the impacts that we made, just under 50 Narcan kits were distributed throughout the community. And within these kits, each of them had 2 doses of Narcan if an individual would need more than 1 dose. Within that bag too, there was a pocket mask if CPR would need to be started, and then also different resources on next steps to kind of combat the, in this case, it would be any type of substance that would result in needing Narcan. So those resources that we were talking about, there's information within that as well. As far as our lock bags and lock boxes, so these are intended for locking up any type of medication that an individual would have. It doesn't necessarily have to be an opioid. It can be even Tylenol. So it's really reducing the access for anyone to get a hold of those medications and then potentially use them for other reasons than they are intended for. And then lastly are our doTERRA bags. So those are medication disposal. So instead of throwing them in the garbage or taking them to the sheriff's office, this is a good, quick, at-home type thing where you just put the medication into the bag, put some water in it, and then it deactivates it with the charcoal packet that's in there. If you flip the page over, then you'll see kind of our committees broken out. So we have 3 main committees throughout the coalition. So Strong Families, Strong Kids, Community Awareness and Emerging Drugs, and then Stomp Out Stigma. So I also am the subcommittee lead for the Community Awareness and Emerging Drugs subcommittee. So again, it just kind of highlights where our events took place and our big events where we made a really good impact. Stomp Out Stigma is more so connecting our guidance counselors throughout the county, allowing them a space to connect, talk about different challenges that they might be having within their school, and then also making sure that there's a uniform front that everyone is getting that same message across for, and then there's no inconsistencies throughout the county. And then lastly is our Strong Family, Strong Kids. This is building up that family relationship for then our youth is having a positive upbringing and then hopefully being more successful in the future. So a little bit of highlights. There was a free swim in July and that brought in quite a few families. I know that there was some popsicles handed out and there was just a lot of good feedback from that. And then we went to the Prentice School District to do a family stepping stone during their family outreach night. And it was very warm to see a lot of the families really interacting with their child, whether it was a grandchild or their actual child, just making sure that those stepping stones were a good personal, what their family is all inclusive of. So that is the annual report.
Any questions for Jojo? Mr. Brodka?
So you mentioned Narcan kits were distributed throughout the community. What entities receive those kits or are utilizing those kits?
Yeah, so throughout that, I was able to train all of Health and Human Services. So everyone over there is trained, whether it would be to administer the kits themselves, or if a community member was to want a Narcan kit, they would be able to train them on how to use it and the logistics of that. I have also given it to the libraries, the ambulance service in Phillips has also been equipped with Narcan kits as well. So really it's looking at the community as a whole, not just making sure that our businesses have it, but we also have community members that have taken it as well. So, and those have been distributed, whether it's through the public health office, and we've given them out during our events too.
Thank you. Nice report.
Yeah, real good.
What is the shelf life of Narcan? There it is.
So the shelf life, it goes until the ones that we have now are from 2028. So I think it's like July. So we have a very good shelf life. The good thing about Narcan too is it's a very longevity of that. So we got them back in, I think, beginning of 2025. And so you're looking at a good 3 years. And then depending on where you store them, that can play a role too, but they're pretty flexible. You just don't want really cold temps and or really warm temps too.
Do you find it hard when you're putting these programs together to get involved with some of the, like you went over to the school district, were they receptive of you coming there and being, oh, good?
Yeah, absolutely. We do. So for the Strong Family, Strong Kids specifically, they have a lot of good engagement with the school district. So one of our members actually works for the Prentice School. So they had formed that connection with us that it was able to branch out into the school. And then we try to make the best connections with each of the kind of sectors that we call. So whether it's a religious group, a hospital, if you think of Embrace too, we try to get every one of those partners to the table for, and then our expansion on events and targeting different age or area groups is really encompassing everyone within the county.
It's good. Also, wasn't Strong Families, Strong Kids, weren't they part of the beginning of Music in the Park?
Yeah, so that's how, so through our Chon Chip, there was more community feedback that they wanted different areas that could touch base on reducing substance use, mental health, and through that, the coalition was made, and then the coalition was actually the one that started to develop that. That was before my time, but they did a fantastic job. And it goes to show, once you start going into the community, making sure that there's buy-in within the community, it can expand very well. If you look at Park Falls, they started Wednesday Night Live. That was a branch off of Music in the Park. So community members definitely want the engagement, want the events. It's just making sure that these coalitions are identifying what areas they want and then making sure that we can adapt to that.
Well, it certainly does beg to Strong Families and Strong Kids when you see how many families are there. And I mean, hanging together, which is kind of cool. You know, they set up their little camps around the Music in the Park. And I think you guys have come a long way with that. So kudos to that. And it's a strong program.
Yes, thank you.
All the way in the counties, all the way through. So
yeah, absolutely. And just to touch on Music in the Park too. So tomorrow, there will be Music in the Park down at Elk Lake Park, and Strong Families and Strong Kids will be there. There will be a free root beer float table, and then there will also be crafts where families can engage with their kids to make, I think they're painting rocks and making bracelets or something like that. So to look forward to that tomorrow.
and I think the weather begs for a good day.
Fingers
Let's
crossed.
hope so, yeah. Well, thank you. Any other questions for JoJo? Well, thank you so much.
Thank you.
Let's get Tiffany up here now for communicable disease update.
Hello. All right. I just wanted to touch base on just a few communicable diseases that we've been kind of monitoring at Public Health while we were looking at typically a wide array of communicable diseases. These are ones that are taking a little bit extra training at this time. Mpox. So Mpox, we recently had 5 cases identified in Wisconsin. It's pretty rare. It could lead to some serious disease. It's part of the smallpox virus family, if you will. So it's typically in Central and West Africa, and it doesn't usually spread in the United States. It was back in 2022 when we started seeing a little bit of spread with that. So we received a health alert last month, I believe, on Mpox, and it's something that through our preparedness, through our communicable disease forums, that they continue just to kind of talk to us about, make sure that we're prepared for how to handle it, how to communicate with the state, how to do testing, things like that. In addition to Mpox, we're also looking, as you are watching the news probably, is Ebola.
Yeah.
Just to give you the CDC update on that, responding to that outbreak in the Democratic Republic of the Congo and Uganda, total confirmed cases are 1,582 with 508 deaths. To date, we haven't had any cases in the United States, and the likelihood is still considered low. One thing that they are preparing us for, again, we've gone through forums, we've gone through tabletop exercises. We're always working on preparedness in case of the event. So one of the things we are watching is any travelers from that area, not necessarily that they're positive, but individuals that have come from that area. They are having us touch base with them, monitor signs and symptoms for a certain amount of time. And then we've also been working with as a region working with our HERC unit, which is our emergency response, on what that means from the local health department side, emergency medical side, hospital side, lab side, states. So I'm getting all those partners at the same table. So if something should occur, we have a game plan of how we activate that process. So again, I just wanted to give you an update. Those are things that we're doing some additional trainings on just to be prepared in that event. So, but low risk at this time.
Good. That's very good.
And then I'll flip to the quarterly update, if that's
Might as
okay.
well. There's no question.
All right.
Okay.
Okay, and we'll start off with communicable disease anyway. So in the second quarter, we had 44 reported cases, which was down quite a bit from the first quarter. First quarter, we saw much more respiratory, as you can imagine, during those months. Our immunizations were down just a little bit as well, but we worked on some more prevention for immunizations and trying to increase accessibility. One of the things that we did come up with, we had some funding to purchase and create. These were made by two individuals based off of the American Academy of Pediatrics guidelines for immunizations. And it's birth to 18 months and then 2 to 18 years of vaccination schedules that are magnets that families can have. So we're using those for education as individuals come in. We're also providing them to the daycares. We'll probably be handing them out at 4K roundups, just so families have that awareness of these are the guidelines. And because, as we know, there has been some confusion with American Academy of Pediatrics, what they recommend, what the CDC recommends. And so we're kind of at least giving them some sort of guideline. WIC had an average participant enrollment that had increased over these last 3 months. We've also seen an increase in our Spanish-speaking families. So between that and our prenatal care coordination, WIC and PNCC have been working together with a lot of those families and trying to do combination visits to help out with the translation services and just helping get those individuals everything that they can at one visit versus having them come back for multiple visits. We have seen an increase in the number of our prenatal care and our targeted case clients. And we're staying pretty close to our regular with reproductive health. Environmental health, we had seen an increase in lead cases in the second quarter. And one of those cases just recently, it became a level that we will be following up with a risk assessment on the home. So the state is going to be assisting us with that because it's at the statutory level for us to go a little bit further. So, and then preparedness, I kind of went over a little bit of the preparedness stuff as far as with communicable disease. One of the things that we did do was an Ebola tabletop exercise. And then we also had our preparedness coordinator, who is Michaela Williams, attend an isolation quarantine session that was hosted by Marathon County. So got some good hands-on experience there. And then she has continued to work on some educational displays for spring safety, weather awareness, and then just overall summer safety. And those are either displayed out in our lobby area, or they have been making their way through different expos and presentations that we've been doing. And then looking at the last part, the community needs assessment and plan, I changed this section up a little bit. Previously, I had broken it out into which each coalition was doing. But really, our coalitions, they work so well together on braiding their efforts so that they're not duplicating services. So I ended up just changing the section a little bit to looking at each specific priority that they're working on, which matches up right with our community health improvement plan. So if we're looking at mental health, whether they're on the Health and Wellness Coalition, whether they're on the Substance Use Mental Health Coalition, whether if they're working on the alcohol grant, they're all of the nurses are pretty much working on mental health. So you can see there's some of the things that they have been doing. One of the most recent ones was that JoJo had done was a youth mental health focus group. So just to get at the library, just to get some more feedback, some more assessment wise, which at the same time is also helping us at Public Health and through the coalition look at what are some of those additional needs that we might be able to use some of those opioid settlement funds for. We're looking at those gaps, digging a little bit deeper. Another thing that they had done is they worked at the Phillips Library on a grant to provide healthy snacks during the youth library program. So again, just trying to get more of that community outreach and involvement. Alcohol and other drug abuse, you could see a lot of the work that has been done there. And just this quarter, the Deterra bags that she was talking about, 107 were given out, 84 lock boxes, and another 24 Narcan kits. And then a chronic disease fee, if you remember, we had ARPA funds back a couple of years ago. There had been money, the state notified us of some additional dollars. So I had talked to some of the staff, and some of our grants in the last couple of years have shifted. So we are not getting as much money for some of those nutritional and maybe physical activity initiatives. Is going more towards mental health, which is great, but then we are seeing a little gap in, some of the other things we're trying to do. So we applied, we could apply for $2,000 for a mini grant. So we did with the thought of helping out with our nutrition and physical activity needs. They came back and they said, oh, you can have 2,400. We're like, great.
Nice.
And a little while later, they said, I'm not sure what had happened if somebody backed out of a grant, but they offered us some more. So we ended up getting a full amount of $5,365. We have a short timeline for that. So it's going to be used for some activities for our Health and Wellness Coalition. What some of the things that they were doing based off of the assessment that JoJo had done when she had done the bento boxes. We were looking at like, what else would the community look for? So they had talked about some food cooking classes, and some things like that. So some of these dollars, the Health and Wellness Coalition will be working, hopefully with like the YMCA to get some of the cooking classes going, maybe looking at transportation vouchers in order for individuals to actually be able to attend those. And then based off of the Schwamigan School has a fuel zone food cart that they have available for kids, so healthy snacks, things like that. And we know that when kids have full bellies with healthy foods, they do better in school. So that's another thing that the coalition is looking at, is helping to get those maybe set up in our other school districts. So, and then just overall agency wise, one thing that we did implement this last quarter was a monthly provider update. So I send out a monthly public health update to everyone here just on education and things that are going on in public health that month. We now also send one that is specific to medical providers. Now this is more looking at when we're working on things with Ebola, it's our communication to our providers. This communicable disease is happening. This is what we need to do. This is what you need to report to us. It's usually about 5 items, something quick. We know they don't have time, but every month that's given to them so that we have that communication back and forth. That's going to Sanford Health / Marshfield Clinic, Aspirus, Tailored Health, in the hospitals. So that way we're all on the same page when it comes to following up on communicable disease. One other additional thing is we, as the Northern region, we had received infrastructure dollars through the state. And as a region, we are working on, or we have hired a epidemiologist who will help us be able to look at disease trends, help us with our CHA and CHIP data. I attended a strategic planning meeting 2 weeks ago where all the local health officers in the northern region were attending. We came up with some good projects. Unfortunately, this funding only goes until the end of 2027. So it's a quick, fast and furious really for us so to get them up and going. Oneida County has taken on the fiscal responsibility of that funding in that position. We are very hopeful that during that time they can help us set up extra data collection and things that we would need in order for us to help out with our community needs. So, and then I just wanted to circle back to the music in the park that was brought up earlier. In the state health improvement plan, now when we talk about our community health improvement plan, that's at our local level. At the state one, the music in the park was identified in the state plan and was written into their write-up as a way for mental health and socialization. So it was identified there too.
Good.
So
Before you go, Tiffany, you mentioned bento boxes, and I'm not sure everyone knows what those are. Can you explain those?
yeah, a while back, we had ordered bento boxes. They're kind of just little lunch boxes. And then those were provided at some of the trunk or treat activities and that other activity that she was talking about with Apprentice School. And we provided healthy snacks where the kids could fill those up. So I think one little kid was so excited because they loved cucumbers and cheese. So, but it was a way to get families to see healthy food options versus maybe just grabbing that bag of potato chips, which is so easy to do.
They kind of look like little tackle boxes.
Yeah,
don't
they do.
Yeah.
They're cute. They're effective, and hopefully families are still using them. And they went to areas in Park Falls, north, central, and south. So the whole county should have been having an opportunity to get those.
That's pretty cool because I think there are some kids that parents couldn't afford them or
Yeah.
didn't see any reason to have them.
Yep.
And so being there and seeing how they could be utilized, I thought that was a great idea.
Yep.
So, yep. Good. Thank
All
you.
right. Thank you.
All right. Thank you so much. Let's go to Aging and Disability and Senior Services Unit. Chris is not available to be here, so I think you will have Dawn speak first about the ADRC Governing Board update and the Aging and Disability Quarterly Report.
Okay, good morning.
Morning.
So first, let's go to the quarterly report. And I think you all have that. So we can see that the ADRC unit had 92 referrals over this quarter. It was quite busy in April and May. June had slowed down a bit, but April and May were very busy. 13 functional screens were completed, 6 enrollments into family care, only 2 into IRIS. And part of that reason is for some reason where the IRIS enrollments are very, very slow. Once we get everything to them, it takes a long time to get enrollment dates. And I'm not sure why that is. So we spend a lot of time waiting for them. So only the 2 for IRIS. And then National Family Caregiver Support Program, we did get more funding for this year. They almost doubled our funding. So we increased the number of slots. So we are now up to 10 people on that program. And then Alzheimer Family Caregiver Support Program remains at 7. And then regarding the dementia care specialists, so the Memory Cafe in Phillips has 10 attendees. That is at Regency, and so that has been going very well. The one at the Presbyterian Church is kind of on hold because we don't have really anyone that's attending that. We don't know, maybe the one is meeting the needs in the community, so we're kind of continuing to monitor that and see if there's a need for that one that was at the Presbyterian Church. I know Shay has met with Judy at the Park Falls Library. They're hoping to host a trivia-based memory cafe in the large conference room this summer. So that is kind of in the works. So hopefully that will take place yet this summer. Memory cafes took place at the Brentwood and Kennan nutrition sites, and that went very well, a lot of positive feedback. So we are planning to continue with those. With support groups, Phillips has 5 attendees, Park Falls has 8 attendees, and virtually 2 to 3, depending on the month. And then Shay is all ready to go with the Finding Meaning and Hope, the Boost Your Brain and Memory. So he's all set to go with that. All the training has been completed, and he's currently taking registrations for that class.
A question?
Yes,
Yeah,
go
on
ahead.
the Memory Cafe, how often does that occur? Like talk about Park Falls, how often is that?
So the Memory Cafe that is in Phillips is every other month.
Okay, and
Mhm.
what about Park Falls?
So from my understanding, this will be the first one that
Oh,
takes
okay.
place this summer that they are working on.
And they had 8 people that signed up for it? Is that how you got attendees?
Oh, that's the support group in Park Falls. I'm sorry, that's different than the Memory
Oh,
Cafe.
okay, I'm
Yes.
looking at this all being part of Memory Cafe.
No.
Oh, this is just a support group.
Yep, so we
Okay.
do a support group that's for the caregivers, and then
Okay.
the Memory Cafe it's supposed to be a safe social environment where the caregiver can bring their loved one with dementia, where they can enjoy some snacks, they can enjoy socializing, and they can enjoy some activities. So they usually do some type of memory activity that might like provoke memories in both the caregiver and the loved one with dementia. So there are 2 different events.
Okay, all right, thank you.
You're welcome. And so then training offered to the community. He is currently scheduling for the dementia-friendly trainings. And the next powerful tool for caregivers class you can see is July 14th, starting and going through mid-August. And then there will be some memory screening events that are scheduled coming up at the nutrition sites. So many things happening out in the community with that. And then with the disability benefits specialist, you can see she currently is handling 14 cases in Price County. The second quarter monetary impact is $40,000, 405. So that is money that is being brought into our community by people receiving their disability benefit. And so far this year, 174,956 have been brought into our community by her assisting people with getting their benefits. And then just to let you know, ADRC outreach. So we've been doing, able to get out and do some outreach again now. So senior nutrition sites, we did Park Falls, Phillips, and Ogama in the last couple of months. And senior housing, we did some in Park Falls, some in Phillips, and some in Prentice. And then as we're able to get out and do some outreach, I will be reaching out to the ambulance service because I know they've been wanting us to come over and do some training there. So I'll be reaching out to them to get that scheduled. And then Adult Protective Services also has been quite busy over this last quarter. I just want to point out with the emergency protective placements, we've had 4 already this year. That's more than we had last year for the entire year. So that just seems to be getting to be more and more often. And then protective placement reviews, we did 18, and the total we had 22 referrals for elder abuse neglect.
Any questions for Dawn? No, that's a lot, but you guys are busy.
Yeah, it's been busy.
Yeah.
All right, so then I will move on to the ADRC Governing Board meeting. So at the Governing Board, they did elections for the chair and vice chair. And then we did some branch updates, but then did like a fiscal budget report. So one of the main takeaways from that is that they are changing the way they do the allocations to the counties. So in the past, they had withheld some of those funds till the end of the year, is my understanding, for like expenses. And now they've chosen to give that money to the counties up front so that they can manage their own expenses. And so our allocation went up. Do you remember how much, Paula?
Oh, I don't remember. I'm sorry. I don't.
Oh, 28,000.
Okay.
Yeah. So that was one of the main things from the budget, is that change in how they're doing that. And then with time and task reporting, so July is here. So now we are needing to get everything entered into the state system Peer Place, and then all of our reporting for Medicaid reimbursement will all be pulled out of that state system. So this is our first month that it's going that way, and the governing board did set some guidelines as far as when those reports need to be done, when the workers need to have their documentation in within 48 hours of when the event occurred. So there was some discussion and some decisions made on that as far as how we all want that to look. And then they did complete a regional management plan, so that didn't really change anything, but put in writing what I do as the branch manager and what Natasha McFadden does as the regional coordinator. So we kind of put that into writing so that we are all clear on what our roles are. And I think that was about it as far as what I had down. Any questions on the governing board meeting? Okay.
And
Okay, so then,
yeah, we're not going to do the Woodland. That was given in May that we did. So
Yeah.
Next meeting is in August.
yeah, the next meeting is in August.
August,
so,
yes.
Right.
and so then moving on, Sarah kind of wanted me to talk a little bit about the I-Team meetings. So I-Team stands for Interdisciplinary Team. So this is a requirement of the elder abuse grant that we get every year. So it requires that we have 4 meetings a year. When I first started, I had them every other month because we were kind of a little bit behind and I wanted to catch up. So what these meetings are is they bring together all of the people involved with elder abuse. So it brings together law enforcement, medical, behavioral health, ADRC, senior services. We have people from the banks that attend, someone attends from hospice. So there are a number of players that all see different things in the community as far as elder abuse. And we get together, we do it every other month. I did at one point say, well, do we want to cut back to quarterly? Because that is really what's required. And nobody wanted to do that. They wanted to stick with every other month. So that's what we do. And so each month, each time we have it, I have a presenter. So this last time it was Sarah Ritalik from the bank who presented kind of on how they handle financial fraud. And from what I understand, I couldn't be there. I really wanted to, but from what I understand, it was very, very interesting. And she went through all of their kind of procedures and so forth. So we've had multiple different people present. So we do that, and then we discuss anything that's out there as far as scams, what everybody's seeing. We also do like if there's been changes. So when the state passed that law that related to Bitcoin machines, we kind of presented on that and discussed that because they did set some guidelines as far as, which it was all really good as far as how much you could transact in a day. They set guidelines on that. And so hopefully there will be a lot less fraud with Bitcoin machines because they found that some like 90% of the transaction through those machines are fraudulent. So they're really a problem. Yeah. So anyway, we, go over things like that, any new legislation that's pending or that has been gone through and become law. And so that is really kind of what the IT meetings are. And they're, like I said, every other month.
Okay.
Any questions on those?
Oh, okay. Thank you.
Okay.
Thank you so much. Council on Aging update. Chris is not here, but Sarah has her report.
Chris is working at the Park Falls dining site, so she wasn't able to attend today. So she gave me some bullet points of what they discussed. One communication, there will be a celebration for Norma Swan, who turns 101 at the Ogama dining site on Wednesday, July 1st. They talked about the April meal site statistics were reviewed. They reviewed the nutrition program first quarter expenses and the revenue. 2 candidates for the site subs have been interviewed for the Phillips site. We are again recruiting for the NAC representative from Brantwood. The dementia care specialist visited both Brantwood and Kennan sites in May, which had good participation. The Prentice Choir sang and played music at the Ogama site. Advanced planning discussion scheduled in Ogama on June 29th. Vouchers for the Senior Farmers Market Nutrition Program continue to be distributed. The Elderly and Disabled Transportation Program has been very busy in April and May, utilizing 4 volunteers, drivers. Reviewed and approved contribution confidentiality policy, and also they reviewed the 2026 MOU for the Ogama Senior Dining Site, discussion regarding the library and the Ogama Senior Site. Both programs are important, but each is funded separately to ensure the costs of one service are not shifted to another. Is there anything else you wanted to add that?
That's more than I remembered.
Oh, okay. And then the next meeting is September 14th at the Kennan Dining Senior Site.
No questions? Okay. All right, let's move on to Kayla. She's here. Children and Youth Quarterly Report.
And that's the one that I handed out with the graph.
There.
Hello, good morning.
Good morning.
Maybe this one here.
Yep.
One with this graph.
This one's it. Yeah. I'll send you him. You can give her mine if she needs one. She might. I don't look like. I don't think. Thank you, Sarah.
Okay, first page just shows Q2 report versus the last few years. We have 15 kids in out of county placement and 9 in county placement. I'll break it down a little bit more as we move on to the next page here. As you can see, this one talks about the types of placements that kids are placed in and the costs of those placements. As you can see, residential care group homes have, just skyrocketed as far as price goes. So you'll see the raising costs of out-of-home placement, and that's just kind of how much it costs. In addition to that, we did place 2, we haven't done this for a while, but we did have to place 2 kids for a stay in secure detention. That secure detention placement is anywhere from $500 to $600 per day. And so that was $6,500 in cost for 2 kids to go to secure detention. So when you look at the next page, you can see that the Q2 cost compared to Q1 cost is already, substantially higher. So with that, we've received so far this quarter 48 Child Protective Services and referrals. We've completed 5 records requests, and we've had 11 on-call situations. We're serving six kids with the TSSF funds that we spoke about before. That's 3 different families. We've received 10 youth justice referrals, new youth justice referrals. Part of this quarter's costs, so sometimes I think I've talked about this before, we send kids for assessments. Rarely, we try to limit that as much as we possibly can because it's so expensive. But so part of that cost for this quarter would have been $20,580 just in a portion of an assessment that only landed in this quarter. So those are 37-day assessments. So okay. Happy news, residential care. We have 2 kids placed in residential care. One of them is doing really, really well and is expected to be coming home within the next month or so. doing lots of visits at home. We transition them slowly back home. So doing visits at home that are structured and set up and lots of services into those homes. And that is going really well. He's a kid that really struggled a lot in the school. So hopefully that transition back into the school will be successful as well. That's a struggle I think I talked about last time, is just we're seeing a new trend of kids. A lot of our youth justice referrals are more kids with special needs and autism diagnoses than they are the kids that are breaking things and vandalizing. They're more so just kids that can't, I don't know. Yeah, it's tough. And the school seems like they're struggling to be equipped to handle this type of behavior as well. So we're receiving, I want to say, I can't remember how many referrals we received on one tiny little youth, 20 maybe, you know, of like within a couple months. And it's like, okay, we have to figure this out. So anyways, those are the tough placements that are there. The other youth that's in residential care will likely transition to a group home, because home will not be an option for that youth because of the danger to the other kids that are in the home. So we'll likely see a higher out of home cost for that youth, because we have nowhere for them to go except for lower levels of care. Mhm.
Question.
And go ahead.
Can you give us an age of 10 and under or 10 and over? Can you, of the two?
Yeah. So one is under 10 or 10 and under, and one is over. One is over that. So, which is, you know, there's residential care centers. So there's a residential care center called Tomorrow's Children, and that's something that's more for the younger age group, but still pricey. And then the other one is actually placed at Hami Home, which is residential care for older youth that struggle with certain behaviors.
Okay, thank you.
So I gave you the good news. The bad news is we do have another another girl who will be going into residential care very soon.
It's too bad.
Mm-hmm.
Okay. Any questions for Kayla?
Sorry, I don't have a lot of happy things to report.
I guess not. Thank you so much. The good and the bad, huh? Yes. All right, let's get Chana up here with the Behavioral Health Unit, her quarterly report. Just so you know, Sarah needs to get out of here real soon for a meeting, but I think they all have to go to that meeting. Oh, sure.
I do have happy news. We have 2 new foster homes that have applied and are almost licensed and ready to take all age groups of kids. So that's exciting, because we haven't had that for a really long time. On the other hand, we do have one that's retiring after 38 years, which Sarah will probably talk about. But I mean, that's happy. We haven't had that for a long time. So we're starting to see, and we have 2 more applicants, which may or may not work out, but 2 that are going to work out. So that's happy.
That is great news. Great news. Hello, Chana.
Hello. So I'll just go into the crisis calls. Unfortunately, crisis calls are on an uptick again. Not sure why. Some of them, at least they're more law enforcement or hospitals are calling, like, we're not sure what to do with this. Can you assess or give us some advice? So those are the ones that fall under info only or non-crisis. You'll see a little more increase in the other result. Sometimes it could be somebody goes to a crisis stabilization bed, or they go to detox. So those I didn't have listed in my other things, so they kind of fall under other. Intensive supervision program on the next page. So there was one person, then I think that person graduated in June. We just had another person start. So we have somebody different this time, actually, because they have an operated well. Let's see, actually, they'd be driving under the influence because they had drugs in their system and not alcohol. So we are having to change up our program for that person a little bit, where we're doing drug testing instead of breathalyzer tests. Comprehensive community services, the CCS program, as you can see, that remains strong. The community support program remains at about 20. Actually, I think it's at 21 now as of July. Coordinated services team remaining about the same with 9 kids in that program. Children's waiver, as we've talked about before, continues to grow. We're at roughly 73 total clients in that program, split between Austin and Bobby Joe. Hopefully somebody else new soon. Birth to 3 is remaining at about the same. Where the new thing we have with birth to 3 right now is we have one family that is fully Spanish speaking. So we're trying to figure out the logistics of that and how we're gonna provide services, because even the therapist coming in providing speech therapy to somebody who is fully Spanish speaking provides a bit of a challenge. So we're working on that. But unfortunately, that child, I believe, is completely nonverbal at this point. They're not speaking at all. So any questions on any of that? And I will say, as usual, we're continuing to work with Kayla a lot on their clients. Unfortunately, the female she talked about that's going to end up in a placement is somebody who has some pretty significant mental health issues. So we're always tagging on those types of situations. So.
Well, thank you all for what you do.
Sure.
Okay. Beth. Not last, but least. Not least either. So go for it. Economic support, Beth Moore.
So I'm going to go over the sheet if you guys have it.
Yep.
So I'm just going to go over the left-hand side, which is Price County's second quarter. The right-hand side is the whole Northern Income Maintenance statistics for the quarter. So we had 1,030 food share cases with 1,781 recipients and $242,242.17 in benefits issued. For healthcare cases, we had a total of 2,404 with 3,749 recipients. To further break down for Badger Care, there was 1,183 cases with 2,347 recipients. The elderly, blind, and disabled Medicaid was 240 cases with 244 recipients. The Medicaid purchase plan was 156 cases with 168 participants. One thing that changed with that program is now a member can go 2 months without paying a premium and not lose their coverage. Previously, it was 1 month and they would immediately lose coverage. MSP cases, which is the program that pays their Medicare Part B premium, 406 with 421 participants. Long-term care cases, which would be our nursing home or family waiver cases, 135 cases with 140 recipients. Other IM programs such as Caretaker Supplement was 268 cases with 420 recipients. For childcare, we have 7 families that we served with 11 children. With $5,365.53 in benefits being paid out. Those numbers are kind of low, but for childcare, they have to have a certified provider in order to qualify, and we lack them in Price County. Any questions?
Bob, do you have a question? You look like you're, no, okay. All right. Thank you, Beth. Oh, it was just the brow that was kind of. All right. Well, was Beth going to talk about the resolution? You will. Okay.
We will. We will. What I am, I don't know if everybody got the opportunity to review the resolution, is creating an additional economic support specialist position. Instead of reading this all the way through, I just kind of wanted to let you know is that our agency was chosen. We had 2 really good workers, and well, maybe what I'll do is I'll start out from the top and kind of explain what it is. In Northern Maintenance Income which is comprised of 11 counties that combine together to administer mandated public assistance programs, including supplement nutrition assistance, which is SNAP, and I think a lot of people have heard of SNAP. The federal budget reconciliation, the One Big Beautiful Bill Act, signed into law on July 4th, 2025, requires states to contribute a minimum of 5% toward the cost on SNAP benefits if their error rate is 6% or higher, facing penalty funding of between 5% and 15% of total SNAP costs. If Wisconsin's error rate reaches 6% on or after October 1st, 2027, the state's 5% cost share would be approximately 69. I probably should put my glasses on, huh? That probably would help. 69 million annually. In March, Governor Evers signed a 2025 Wisconsin Act 116, which, among other items, appropriate additional funding to Wisconsin DHS for quality control to ensure that Wisconsin stays below the federal required error rate. The State of Wisconsin Department of Health Services awarded the Northern Income Maintenance Consortium an additional $672,000 funding to develop a robust quality assurance program. Approximately 6 new quality assurance positions will be added to the Northern Income Maintenance Consortium utilizing the new funding. Subject to the approval by the 11 directors of the Northern Income Maintenance Consortium, Price County was chosen to hire one of the 6 quality assurance positions. And that is actually an honor because we have actually 2 really good workers that were qualified, except for we could only get 1 position. And so one was chosen to do the qualified. And that means like checking errors and on all the reports that come in. So that was an honor. The increased cost associated with this position is fully covered by additional revenue and will not require any county tax levy. So,
Yeah, just to clarify a little, it sounds like we're trying to create a position. Really, we're trying to house an additional. It's almost a better way to say it is we're housing an additional position. So we currently had positions housed here. One of those individuals was chosen to be part of this quality assurance leadership type, or a different position, which opened up that the state can now, they hired 6 new people, which one of ours was moved into that spot, opening up the economic support worker positions. However, in order for us to house them, we have to have this resolution saying we will house more than 2 employees or whatever the number is. So like we're saying we want to rehire for the consortium the position that they actually took away, and it's not creating, it's housing. So you know, one county could house all 100 positions in the consortium. I'm making up a number, it's not 100, but like they're saying we house them throughout so that one, you have economic development in your area by housing new jobs, you're paying individuals to be here, it's good for your community. So it's a little deceptive. It's not, we're not creating an additional, we're housing an additional position because one of ours got hired at this. Now, say that individual left, we would then go out and try to hire that position. We wouldn't go backwards or have a problem. They may look at going, oh, we can't hire one here, so you'll house it somewhere else, but it doesn't affect us financially. It doesn't affect us in those ways. It's just we have to get an approval to house additional staff.
Paula, Mary,
Yes, go ahead, Brian.
does the county get reimbursed for the housing?
Yeah, so like if we need desks or computer, it's through the program. We're just administering it, housing it here because we're part of the consortium. So the way, like, if a call comes in, our people may be answering calls from any one of the 11 counties.
But I'm referring to like the space itself physically.
Yeah, it's through the
rent
PARs.
or
Yeah, it's
something?
not like so we divide the whole building out by square footage, and then we get like a reimbursement to offset.
Just curious.
Yep.
Mr. Kopish?
Yeah, I just need a little clarification. What does an error rate mean?
oh, we should have kept Beth here.
Huh?
Because Zach, I said we should have
Beth would be the perfect one
Beth
for
would
that.
be the
but-
perfect one to bring that, and I could have had her explain that. But what they do is they take like the Northern Income Maintenance. Actually, I was going to talk about that next month because we ended up out of the state being one of the top with having less errors.
The
in our
lowest
work.
error
The
rate,
lowest,
yeah.
yeah, lowest error rate. So it's like the errors like monthly income, that maybe they missed or they.
It's
didn't
poor
put-
data. So like
Yeah.
anytime there's poor data in the system, so if an individual didn't report correctly, it can come back as an error. If it's overpayment, underpayment, it's if they look at it and go, your worker or the worker didn't administer the program
They is
properly.
the state?
Federal.
Federal.
Well, it's
So
the
there's
state gets
people
graded.
at the federal level that are looking at all this stuff and seeing if you're making mistakes?
They will be covered, the federals, yes, the federal will be looking at.
But
this.
yet we can have $9 billion getting spent in Minneapolis and nobody knows what's going on. Isn't that kind of strange? Anyway, that's just a side comment.
I second the side comment.
Yeah, it's something doesn't, but so they are looking at this.
At all, yeah.
And
in
that's
all
what that
states.
means. We're somehow making a mistake on something we're doing. So if we're over that 6%, first of all, we have to contribute at least 5% minimum. And then on top of that, we could get a 5% to 15%.
The state does.
The
We
state,
don't.
yeah,
The
we
state does.
don't.
This is a
Not
state.
the northern.
Yep.
It's
So
the
this,
state.
this is a
State.
state
This is
mandated.
a
program.
statewide
Yes.
issue. Okay.
This is a state mandated program that the state contracts with us to administer.
Okay. And so the state gets penalized.
Mhm.
Okay. I thought the SNAP program went away last year.
The education side of it.
Oh, just the education side. That's what affected us with
For the
extension.
Extension. Yep.
Oh, okay. All right.
Yep.
Not, okay. All
And
right.
at
This is
Good.
the.
yeah,
this
WCA
fiscal
talks
part.
about this quite a bit. We were, I
Okay.
can't remember if we were the lowest in the US
Yeah.
on
but
error
that's-
rate or like the fourth lowest. We were in the,
That's what I was gonna talk about, because
Yeah.
we got that.
Yeah.
so like we're way below the 4%. I think we were at like 3.1 something. It was very low.
That's
We were
good.
one of the lowest. And then, they go up from there quite
Okay.
a bit.
Thank you. That helps.
Just to clarify, we don't pay anything unless there's an error rate over 5%.
We don't even pay that.
No,
The
it's
state
the
does.
state.
So the
Okay.
state goes, we need more people to make
Because-
sure our error rate doesn't go up.
So there is no 5% contribution somebody mentioned, or
No, no,
that's what I
no.
heard.
Yeah, so the state gets a bunch of money from the feds to say, do our programming, the federal programming. The state then goes, how the heck do we do this? Oh, we're going to make consortiums. Oh, you made the Northern Consortium. There's 11 counties. Your 11 counties going to get $100 million, $1 million to do this programming. Then all the 11 counties go, I would like to house a person. I would like to house a person. Everybody had to house at least one because you can have walk-ins. Beyond that, if you have the space and you want to do it because it helps your community because you're offering jobs, that's what it comes down to. The state then said, okay, in order not to pay the extra $70 million or $69 million, we have to make sure everybody's putting all the data in and making sure the programming is right. So the state approved additional spending to not have to spend the 5% or above. So then the state said, okay, we're creating these positions. The consortium got this new position that is an error rate specialist. That's not what it's called, but it makes sure that's everybody's following the program, make sure there's less errors. We were lucky. We have very good employees. They applied for it. They were accepted as that person. We could just say, nope, we still only have 2 people here. We don't want, but the consortium has of it 6 new positions, but now one of those is actually a income maintenance worker generalist, which we would like to house here because again, it brings a job to the community.
Mr. Brodka.
So you just mentioned that this is a state mandated program that the state is reimbursing us to house this person. My only question would be, is there a risk to us down the road where they eliminate the funding, but the mandate stays in effect like they've done in the past?
Right.
Yeah,
That'd be my question.
Sustainability, right? Yeah, yeah.
Yeah, the position would go away. It's a consortium. So it's kind of, they are our employees, so they fall under everything. The consortium is the one who allows the employee. We would never go, if the consortium said, oh, we're short $5 million and we need to, there's no reason for us to maintain those positions. The consortium will go, we're going to cut your funding and we're going to cut these 9 positions. Oh, Price County, you lose a position. It most likely would be through attrition, but the consortium would be the one paying for or dictating. So the risk would actually be we may have to lay off a local employee.
Okay. Yep. Thanks for the clarification. I think it's a great idea to have them in the county.
Mhm.
I don't deny that. It's just when you get into
Yeah.
state funding and mandated stuff, you got to be careful how you're proceeding, I guess. So thanks for the
Madam Chair,
clarification.
Yeah, and this would be the
that answered
feds,
my question.
right? So it's federal funding going to the state. The state then would have to decide if they want to make up the difference. It wouldn't be pushed to us in that case.
Mr. Kopish?
You want a motion?
Yes,
I will make the motion to approve as presented.
and move it to the administration? Does that go to administration or to the county board?
I don't
Goes
know,
to-
probably goes to the county board, doesn't it?
I would say county board, because you're not creating a position, you're just housing it.
Well, it does
So,
say that
do we
ad-
want to,
admin will develop the job description.
which we already have a job.
Okay, so we don't have to go there. So to the county board.
County board, yeah.
Okay,
I
Motion's
make
been
the
made.
motion, yep.
I'll second that motion.
second by Mr. Baratka. Any other discussion? Hearing none. All those in favor?
Aye.
Those opposed? All right, motion carried. And then you have something for us to sign there, Meredith? Thank you. Let's move on to, is that it for you?
Yeah.
All right. Carrie, come on down. Thank you. High-cost placement reports.
Hello. So again, you kind of hear the quarterly reports from the different units like Trana and Kayla. So then they kind of, all that kind of describes everything that's happening on here. You might ask, well, how are they able to give their quarter two reports and you don't have any information for June on here? Because I asked myself that. But so what it is, especially for like the children and youth, we're able to get some of that data through the different systems that we have in the state, but they haven't quite hit our accounting system quite yet, just through just how it comes. So if you're kind of wondering that, that's a little bit why, again, our accounts are always a little bit behind. But so the things that they did see, you will see them reflected on the next one and see these numbers jump up quite a bit higher than. Any
So-
questions?
They look good today. Just next-
Well, not exactly, but
They look better than they
they look better than
Than
what
they-
they actually are.
than they will next month.
Yeah.
Any questions for Carrie?
Yeah.
Oh, I know.
Mm.
Just, you know, we can pick on.
To simplify it too, it's like the credit card, right? We've swiped it. We know that we spent it
Hmm.
with these programs. We just haven't gotten the bill for 28 days. So
Ah.
when the bill comes, you have the little shock after Christmas. kind of
Yeah.
thing.
well, All right. Thank you, Carrie.
Thank you.
All right, Sarah. Director's report.
Okay, I'm gonna mention as with Megan leaving, we have attorney Bryce Shaneborn and attorney Mike Scheffler. He's from a Medford office. He is helping out with the children and youth APS and the behavioral health unit. Children and youth, they applied for a foster care grant and they received $5,000. And that will be used for retention of foster parents, foster parent training, and then also improving normalcy of opportunities for children in out-of-home care. So that was exciting for them to receive that $5,000. Next month, I would like to invite, and I guess I'm just asking, I'd like to invite Connors. They have been foster parents for 38 years and they're retiring. And they said, oh, maybe on this, if you really need us for a couple days, we would be willing to help, but I would like to honor them. I mean, it's a lot of years. And sometimes I kind of feel like when we go to the county board, that's great for the county board, but I believe that Health and Human Services, that's kind of where we work from. And so I'd like to invite them here. So if that would be okay next month, if they're able to make it, I would really like to invite them and maybe we'll get a cake or something. for
That's a
them.
great idea. There used to be like a picnic or something years ago for
We
the
have,
foster
but
care.
we've had just so few, so we've done
Yeah.
gift baskets and
Yeah,
things,
okay.
so.
Good idea.
We used to do dinners too,
Dinners,
yes,
yeah.
because Joe was a foster parent. Yes.
That's right.
So, okay, and also for our personnel updates, so the behavioral health unit really has a lot of positions open. Austin has just resigned from her position. She was our CCS, but she is doing LTE, so she is working part-time for us. And then Katie Kirchmeyer has left, so that position's open. And then we have the 2 other positions open. So we do have interviews this coming Wednesday. So hopefully we will have good news for that behavioral health unit. And that is, I believe, all I have. Yep.
Okay. All right, before we close, it's not on the agenda. I'll put it on next time, but I just want to inform you that I was selected and appointed to serve on the Wisconsin Counties Association Health and Human Services Steering Committee. And our first meeting will be on Monday down in the Dells. So I think there's like 30 of us, so it'll be an interesting one. And I'll come back with information. There are only, I understand, only a couple that are up north down on this meeting. So, and that means above 8, Highway 8. Yeah, so I'll bring that back to you.
Participation.
Oh, yeah,
is next time.
that's right. I don't,
Later in the afternoon.
yeah, we'll do that. Yeah. So just, and I'll come back with a report on that at our next meeting to tell you what I'm hanging myself for or something here. So thank you. All right. So our next meeting is the public participation meeting. So it's going to be an afternoon meeting. We'll have the meeting at 4 o'clock. Our regular meeting will be at 4 o'clock on August 12th. And then we'll go at 5 o'clock to the public participation. And I'll try to beat my record on that one too. So depending on if anybody's here.
What's the record? 4 minutes, 3 minutes?
Less, I think. I just read through everything. That's it. Unless someone happens to be here. So that's August 12th at 4 o'clock in the afternoon for the regular meeting. And then 5 o'clock, hopefully we can get through really quickly. And then 5 o'clock, we'll get everybody out of here.
At 5 o'clock or at the end of the regular.
At the end of
meeting.
the, right.
No sooner, but it could be later.
Yeah, could be.
The public. Yeah. Yep.
Okay. All right. And at that point, this meeting is adjourned. I'm sorry. Run, Sarah, run. Run, Forrest, run. Will you be back?